I want to talk about in this podcast the importance of the frontal view. Many people look at the three-quarter and side view as being very, very important, and I would not disagree with that, especially when you're looking at a facelift or a rhinoplasty. The side or profile view becomes very, very important. However, when it comes to fillers or fat transfer, there are other elements that the frontal view, to me, really shines through with volume. And the reason for this is even though people do a three-quarter view to try to highlight the volume, we relate to each other from the frontal view. In other words, when I have lunch with you, when I shake your hand, when we have a communication, when we have a business meeting, I am looking at your frontal view. And so that is the way that I judge my work. The problem is oftentimes when we're doing fat grafting or fillers, we're coming in from the side of the face. So we never look to the frontal view. But I noticed this the other day and I thought, hey, I should do a podcast on this, is I was filling a patient's fillers and I put a little filler in and I constantly look back to the frontal view to take a look and to see if the volume is correctly placed. So I constantly readjust and look from the frontal view to determine if this is the appropriate amount. Because let's say I put a lot from the side view and I looked at the frontal view, all of a sudden I see a bulge. Well, that's not going to look good. I've actually created that problem. Many years ago, I did some fillers in the outer jawline. It looked really good from the side view. When I looked at the frontal view, it looked flared out. So the lesson, not only for the providers out there that teaching them to constantly look from the frontal view, but also for the patients, is that when you're judging the work, I think the frontal view is so important and it's not to be underestimated, even though it may be more subtle in things like rhinoplasty and facelift. So I think the lateral view can oftentimes be more powerful for surgical options, but for the non-surgical options, I think the frontal view can be sometimes even more powerful than the three-quarter and side views.